This is Nonprofit Montgomery's weekly Zoom call with nonprofit and community leaders. Leslie McDonald, I'm Executive Director of Nonprofit Montgomery, and I wanted to just review the agenda and let you know who's on the call. Let's see, and also just to remind you, questions in the Q&A box and sort of general information, and watch the Zoom chat for other details and resources. So first up this morning, we're going to welcome JoAnn Barnes, the Chief of Child and Youth and Family Services for DHHS, and she's going to give us an update on the Emergency Assistance for Residents program, which is just getting off the ground. And she'll take questions on that program for anybody who needs to ask a question. We're also going to have Mark Hodge, also from DHHS, to talk about the food access grants, and people may have seen that they've already released a list of who got grants in the first round. So Mark is going to tell us about that. And then for this call, we really wanted to have an opportunity to focus on how immigrant communities and hard-to-serve communities are being served in this time, what the needs are, who the nonprofits are that are serving those folks, and how it's all tied together, and really where the gaps are. So we have, first up, the Gilchrist Center. We're going to have Josephine Garnem and Yunie who will talk about what the Gilchrist Center does and how it provides sort of one-on-one help and information and resources. So something for everybody to know about going forward. Also, we will move to a panel where we're going to talk, do a sector update from nonprofits serving immigrant communities with Diego Uriburu, Executive Director of Identity, Paula Fitzgerald, Executive Director of Ayuda, and Cecilia Rojas, Director of the Language Outreach Program for Community Reach. Really getting into how a lot of the Latino community is being served or not served at this time. Ending up the call, we'll have Franca Brilliant with a funding update, what new sources are opening up, and what the federal and state funding situation looks like. A program update for Nonprofit Montgomery, and then brief commentary on the FY21 budget. For those of you who don't know Nonprofit Montgomery, we're an alliance of nonprofits that serve Montgomery County. We do capacity building in the nonprofit sector and advocacy on behalf of nonprofits and the people they serve. So welcome everyone. Forgot to mention that also in the background we have Caroline Sturgis representing the Office of the County Executive, and Vicki Buckland from DHHS. To both available to answer questions that people might have or respond to comments that people might be interested in making. So put those in the Q&A box. So that's the agenda for today, and let's get started. Welcome JoAnn Barnes to talk about the Emergency Assistance for Residents. JoAnn, can you join us with video? Thank you.
All right.
Welcome. Thanks for being here.
Good morning. First I want to apologize. I'm not going to be able to stay for the whole meeting. I probably will get off at about 11:45. So hopefully I will leave you with enough information, and most of you know how to contact me if you have any questions that I'm not able to answer. So I wanted to talk about, I heard you call it the Emergency Assistance for Residents program. We've been referring to it as the Emergency Assistance Relief Program.
Oh, sorry, I got it wrong.
But no, I have seen it written that way. I'm not sure where the separation went, but I'll know what you're talking about. So I did want to give a brief update on phase one. Phase one, HHS took action based on the families that were enrolled in the Care for Kids program, and we sent those benefits out starting on April 27th. I'm pleased to say that over 70% of those benefits have been cashed or deposited. And so families are already able to use those funds. Phase two, which is going to kick off on Monday, which I think you'll wonder why I'm going to be so vague. There's still so much that needs to be worked out between now and Monday, but I can tell you a lot about the process, and then more will be coming out as we finalize some things and start to put some names out in the public for people to know how to access the benefit. Phase two is going to be a partnership between the county government and certain nonprofits in the community to take applications, starting with families that we already know because they're participating in programs throughout the county. So we will have about 5 partners that will be taking applications for the program and entering them into the database. We want to operate this as a referral program, which just means that you have to have a referral to get your application in, or come through an agency that's given you a referral. So we will have certain nonprofits that will take referrals, and then we'll also have a way for other nonprofits to connect with those particular 5, let me call them the fast 5. And what I'd like to do, if we can, Leslie, Anna Hargrave and I have been working on jointly on how to identify who can be a referral agency. And we'd like to send a survey through you, if you would send out a Survey Monkey for us to find out what agencies would be interested in being referral.
Fabulous.
Partner.
Yeah.
Okay.
Yeah, we're happy to do that.
So outside of those referrals, very similar to Manna Food Center, you can also get a referral from 311. And so we're going to implement a similar methodology. My call with 311 is at noon, which explains why I have to get off so we can finalize some processes. But the plan is that if you're not able to access through a nonprofit, that you would still have the ability to go to 311, and you would 311 could refer you into the queue. I think that without a doubt, you're going to stand a better chance if you come in through a nonprofit. If you come in on the queue, I imagine that queue is going to grow through MC311. And so that's probably the slowest way that a family can connect. It'll be much more beneficial for them to connect through a nonprofit. But MC311 has agreed to to take the information from families, put them in the queue, and then they will get a call back from one of the agencies that will take applications, and we can process that way. As you know, as you may know, the benefit ranges from $500 for a single adult to a maximum of $1,450 for a family with 4 children. If you have 6 children or 7 children, it still maxes out at the $1,450. So we estimate that with the $5 million that we're initially distributing, that's going to serve 5,000 families. I may have said that before the last time I was with you guys. And then the county has appropriated an additional amount of money. And again, I estimate that on average, because of that range, 500 to 1,450, I average, I do my math just based on $1,000 as an average number of grants we'll be able to issue from whatever funds we have available. So phase 2, I think, is going to be where many more families can access the benefit. We have been cautious about building a system that looks similar to the holiday giving database. So many of you are familiar with that. We have been we have been careful about taking into consideration that we want this application process to be one that doesn't create anxiety, but without a doubt, there are going to be some wait lists with this process. We believe, just based on the calls that have already been coming in through 311, that there's going to be a huge amount of interest that exceeds the funding that we have. So we want to try and do things with a process that has some dignity attached to it and doesn't create a lot of anxiety. It could be that more calls come in to 311 that we're able to fund. So our plan to work with MC311 is at some point to have to say, we'll take your name and number and put you in the queue, but you may be on a waiting list. And then if it continues to grow and we know that we've surpassed our funding, we will actually have to say that program is not taking any more applications. But initially, we think that establishing that queue through 311 will help us track the need. And if we have to go back to our leadership and demonstrate, you know, what the need continues to be, we would have the data to do that. I'm sorry, my notes just disappeared. Let's see. I think I've covered pretty much how this will work. We are working with the key nonprofits. We've been meeting with them 3 times a week to get things up and running. We have a training for their staff on tomorrow, and on Monday, this will be up and running. We're confident of it. And there will probably be a press release to go along with that to inform people and nonprofits how to access the system.
Great. So you mentioned that there's going to be a survey that people who are interested in being one of those 5 nonprofits will answer the survey. No, that's a different survey.
No.
Can you explain?
Well, yeah.
Okay, thank you.
So we've already identified the hub. We want to identify other nonprofits that can be referrals into those hub agencies. So there's a difference between referral agencies and processing agencies. So we've identified the processing agencies as organizations that we know have some infrastructure to be able to help us with this work. So it's the difference between processing and referral.
Thank you for clarifying that.
Okay.
So the survey will go out this week for nonprofits that want to be able to refer to those 5 sort of central nonprofits.
Yes.
And then on Monday, you'll start taking referrals through 311 and kind of publicly reveal who the 5 nonprofits are.
Yes, because,
is that right?
And you hit a key point, Leslie. Just in order to keep this manageable, we don't want to overwhelm anyone. And we want to have a process that balances the workload across the different agencies. So when, you know, we don't want everyone to go to the most popular nonprofit because they know that nonprofit. We definitely need to sort of act like the air traffic controller to make sure that we are pushing the applications equally around our system that we've built in order to keep the processing flowing.
Great. Okay, perfect. So people, nonprofits should look out for that survey later this week, and then more will be sort of made clear on Monday.
What I would say is a referral agency would be one that would collect some minimal data from the family and make sure that it appears that they would apply. So you would probably go over like 4 or 5 screening questions, and we'll give that information to any agency that wants to refer. And then they would send a referral to the processing agency. But we would hope that you would at least check to make sure that they fit the main 5 criteria.
Okay, so they'll be screening for eligibility.
Screening.
No, just doing a preliminary screen.
Screening, yeah, not
perfect.
Yeah.
Okay, great, thank you.
Lots of questions for JoAnn in the Q&A box, Leslie.
Okay, yeah, let me just get to that. So one question is, you know, you said it's based on family size, and there was a question, what if the child's address has changed or the child is no longer living with the parent?
The grant should be based on who has custody of the child. So there will be some situations where a mom and a dad might apply as separate households. The child should be on the application of the person who has custody. And that's why when you actually get to the approval process, one of the things that we'll be asking for is proof of who lives where.
Okay, Great, thank you. Well, I think the most frequent question asked here in the question and answer box is, who are the central 5 nonprofits?
I'm going to ask if I can defer on that,
Okay.
just because we still haven't worked out all of the details, and I don't want them to get inundated before. We will get that information out to you, and we will definitely share it with Leslie, so Leslie can send it out through her blast as soon as we finalize all of the red tape, if I can call it that.
Great, okay.
I hate to be so vague.
No, it's okay. We just appreciate that you're giving us an update mid-process. So, so it's good to hear. So people are also asking who will be receiving the survey, so referral agencies can be identified. So anybody who gets Nonprofit Montgomery's e-news, which you can sign up for on our website, nonprofitmoco.org, and get on that e-list. If you're invited to this call, you're already on our e-list. And you know, you'll probably be sending out more broadly as well. JoAnn, or just through us?
I think just through you.
Okay.
Okay. Yeah, I think
all right. So anybody who's currently on the call, you'll see that coming out from us in e-news, and then please do share that with anyone you know who may be serving people on our list. Okay, that was basically the gist of the questions. People wanted to know how you chose the 5 and who they are.
And again, it has to do with capacity.
Capacity, perfect. Okay, great, thank you. Well, thank you, JoAnn. I see Caroline has joined us. Oh, you're mute. Go on, Caroline.
Hi, thank you, JoAnn, for the update, very informative. 2 quick things that I also wanted to follow up on as far as receiving notification. Of course, we will do it through the press release and all of those on our list. One of the recent updates that we did to our COVID website for the EARP page is that we did create a sign up. So as individuals are going onto the website, if they would like notification of when there is an update on the program, they can sign up to get that notification. The other thing I also want to clarify is when we do make the announcement, we will be announcing all 7 of the community partners that's assisting us with this particular program. One of the things we realize is for individuals, residents, households who may already have a relationship with those existing 7, we would want them to reach out to whomever they have that relationship with to process their application. So just want to be clear that we will be announcing all 7. That's it. Thank you.
Perfect. Thank you. Thank you so much, JoAnn and Caroline. It should be a busy week next week when this is all revealed, and so it'd be nice to see the funds getting into the hands of the families who need it. So thank you so much for your work on this and for joining us today. Next up, we have Mark Hodge, who's going to give us an update on the food access grants.
Thank you, Leslie. It's been a week since we announced that the applications were open for the food assistance grants for COVID-19 emergency on this call. They've been open last Monday and they closed this past Friday. We worked very hard over the weekend, some of us, even on Mother's Day, to look at all of the 105 applications that were received. There was only $1.2 million available, and as of yesterday, as many of you may have seen in the press release, that we were able to fund 38 of those 105 applications. So we are in the process now of getting the grant agreements prepared and to go out to those 38 organizations. And then once we receive those back, we will be sending out the money. So hopefully by Friday, all of that $1.2 million available will be out the door and be available to start serving the residents. It is likely that more money will be coming. We've gotten some hints from the county council and the county executive that, that this first tranche of money, one, obviously isn't enough because of the number of applications we received and the need discussed in those applications. But there should be other funding sources coming for that. We will likely use the same process. One, it's established and fast, as we have shown, but also an easier way of getting the money out the door as quickly as possible and into the organizations who can then feed our residents. So I'm very happy with the process we used. We did have a variety of people who did the reviews of those applications. We had 30 total, including half of those are actual recipients of food assistance in our community. So community members who helped review those applications, as well as HHS, other county people, and other organizations, other nonprofits who are in that space as well. So we had a good number of people reviewing those applications, and everyone did a great job. And I'm very thankful for the time everyone put in to do that, and very happy to say that the process worked and we got the money out the door as quickly as we possibly could. Probably faster than any other time that the county has been able to give money to people. So it's not an easy process usually.
Yeah, and thanks to the Healthcare Initiative Foundation for being willing to be the conduit for those funds.
Yes,
so Mark, having read all those applications, I think you said 105, or at least being familiar with them, is there any overall learnings you can share about what's going on? And I know the food sector is quite organized, but any learnings about the need, or who's serving who, or how it's all working together? Anything you can share?
And the great thing about the 105 is we had the usual food assistance providers in that mix, but we also had a lot of new startup organizations and churches and others who didn't initially participate in food assistance programs just because they had other places to focus their efforts. But what this has shown, and looking at all the applications, is just the number of people who need food assistance. The one thing that we did see that unfortunately we were unable to fund with this first set of money was it's not just about food, but other household items that people are looking for: detergent, hygiene supplies, toilet paper, things that they don't have access to as well. And so that a lot of the applications asked for funding to be able to purchase those things to also distribute as part of the food assistance boxes or other means of getting the food out, but that they could also provide those other items as well. And so that's something that we looked at, something that we'll consider when more money comes in, that there are other items outside of food that are also important for those households. The other piece of it is, I think we are reaching people. One, there are people who didn't need food assistance 3 months ago or 4 months ago and have lost their jobs and now need that. So there's certainly a lot more people who we've identified who need that service. But in addition to that, we're identifying pockets of or neighborhoods of people who didn't necessarily have access to those resources previously. Not that they didn't need them, but that they just are part of a hard to reach community. And so we're finding organizations that are actually able to get into those neighborhoods and into those communities like never before. And that was the exciting part about being able to fund some of these organizations, is that they were actually reaching people who hadn't been able to access those resources before. And so that was something that we were proud of, and certainly expresses the need for further funding for this moving forward.
Great, thank you. I know one of the questions that was submitted in advance is how can faith communities help from home? So it sounds like donating household goods, detergent, things, diapers, things like that might be a way that the faith communities could help from home.
Yes, absolutely. Now, in addition to shelf-stable foods and donations like that, those household items that you don't usually think about, and they're not as exciting as saying you donated food, but are equally important in the lives of the residents. So yes, absolutely, it's something that they can do.
Great, perfect. Well, thank you for the update. And also wanted to mention, for anybody who's interested in being connected to what's going on in the food sector that the Montgomery County Food Council does a weekly call, I believe on Monday afternoons, and you can go to their website and sign up to participate in those calls and really get a good view of what's going on. Anything else you'd like to add, Mark?
Nope, that's it. Thank you so much.
Great, thanks for being with us. Okay, good to hear that county money that has been allocated by the council is flowing out to meet the residents' needs. So thanks so much. Okay, so next up, we're going to turn to the Gilchrist Center to really kick off our discussion about how immigrant communities and hard to reach communities are being served. So we have Josephine Garnem from Gilchrist Center, and also Yunie Hong. Yunie's not on camera, but she is on phone to sort of fill us in on how the Gilchrist Center is meeting the needs of those populations and how nonprofits can connect people to you. So please, Josephine, welcome. Oh, you're mute. Just unmute yourself. Perfect. Thank you.
There we go. Good morning. Thank you, Leslie, and good morning, everyone. Thanks so much for all that you're doing. First of all, let me talk a little bit about what the Gilchrist Center does. So we look very much like a nonprofit, and sometimes that is a little bit, that's intentional, but we are part of Montgomery County government. We're a very small team, and our goal is really to provide a pathway to community resources to help our communities and immigrants thrive. So we serve everyone, and we do a lot of research on the resources that are available, and through that we like to think of ourselves as between 311 and caseworkers. So doing a little bit of both to serve our communities. I'm gonna share my screen with everyone so we can see our website, the Gilchrist website. Give me a minute here. Can everyone see my screen?
Yes, thank you.
So this is our website, and hopefully, Leslie, you can put that in the chat box as well. So some of the work that we're doing, so right now we have about 108 clients that are taking citizenship classes. We also have rolled out our English classes, conversation classes online. And also because most of the resources that are now being put out there are web-based, we are doing computer classes for the community, free computer classes, just to help people understand how to go online, how to look for resources, and how to access these resources. One of the things we're really proud of at the Gilchrist Center is creating a really exhaustive community resource list. Let's see here. So in this list, and thanks again to Yunie and our team, you can see here a list of, financial assistance. You go down, you see all the list of resources that are available. It's kind of one place to go where you can find as much information as possible, where you don't have to go through several websites and several links. Someone spoke, I think Mark spoke about the food resources, so we have that as well there. Crisis services, healthcare, housing, our mental health and wellness. One of the challenges we found at the beginning of this, the COVID-19 pandemic, was where to find mental health resources, where people can go to that are still working, that are still serving remotely. And we're hoping people will take advantage of this and really access this list. Is, of course, we try to update it as much as we can, but it will give you some information that we think is really helpful for our community in terms of where they can find helpful resources. Another good one is the immigrant and language resources, where you can find something, for example, language hotlines, different information, COVID information in Amharic, Chinese, French. So again, these are infographics that you can access, look at the resources, eligibility for COVID relief programs. So we talk a lot about, a lot of people call us all the time asking, am I eligible for this? How can I know if I'm undocumented? What are the resources that are out there for those that do not have their documentation? So this information, we try to put everything in one place. Hopefully our partners will be able to access these information as a kind of like one place where they can find as much, not everything, but a lot of information that will be helpful for them. Immigrants' rights, DACA, general COVID resources, relief funds for undocumented immigrants. So we're hoping that these links and these resources will be able to at least guide our partners and even community members who are able to access it. Another very helpful information that we have, of course, you have here the food assistance resource map that tells you based on your zip code where you can find food resources. Another, and we are asking our partners to also, I don't know if people know about this, to receive notifications in Spanish from Montgomery County regarding COVID-19. We have our Latino liaison has actually created a WhatsApp group. And if you can send to your clients to text HOLA, HOLA, to this number here, 2404-471862, they will get, our Spanish-speaking communities will be able to get regular updates in Spanish on what is happening in the community and resources as well. Another thing that I'd like to point to our community partners here is this, HHS actually has info on current status of programs and how to apply. Now, I don't know if our partners know that this information is in English and Spanish. So not many people are aware of this resource that is here regarding the resources and grants and programs that are out there that partners could apply for. And this is also in Spanish. So please share this link with others so they can see. Yeah, so that's a bit about what we do. And we're really hoping that our communities will use this. We also have a Facebook page in terms of constantly putting up information for our community members and for our partners to use.
Right. Josephine, I know you take calls and help people directly Monday through Friday, sort of 9 to 5. What languages what languages can you accommodate in your call-in? I see your resources are mainly in English.
Well, actually, we are very proud to be a very diverse team. So we have about 12 languages spoken just among our small staff that we have and our volunteers, but we also have access to the language line. So the county has a language line where, irrelevant of what language you speak, if we don't speak that language, we can call the language line and serve our communities. We haven't had any problems in terms of serving languages because the language line is pretty diverse. So, but we have French speakers, we have Spanish speakers. I speak some Arabic, Creole, Mende. We have a Japanese speaker, Korean, Chinese. So as small as our team is, we are very strong in terms of language access.
That's great. And I'm hopefully somebody will put in the chat the number that we can refer people to. And I was curious, like, are you seeing an increase in demand for your services, or are you aware of needs that aren't being met just from the calls and that you're getting?
Yes, so since COVID has happened, our phones are ringing off, off the hook. The needs are great. And I think Mark or someone said before, every day there's a change. So if people had housing yesterday, today is a very different case. And so I think the biggest need we have right now that people calling for is housing. Another big need is for food. Unemployment has gone up. And also in understanding the EARP, when that is coming out, what are the eligibility, how people can access it. And another challenge is that even though there is food banks and there are food drives that are happening, transportation is also a big issue. So a lot of these food drives are for people who have cars and they drive through and the food is given to them in their trunks, whereas some community members do not have access to transportation. And so having, that, hopefully more and more organizations will be able to find ways to serve those who do not have transport. Another challenge is that our communities are scared to seek services, especially the immigrant community is very, very worried. A lot of information, as I told you yesterday, had gone out about public charge, had gone out about census and this, the penalties that you would have. Now, not enough information had gone out to say that there are no penalties, that people can access this without any problems. And so people are still scared in seeking social services because they feel that they'll be penalized or that they will be, their information will be stored for ICE. So that fear, I think a lot more has to be done in sensitizing the community that it is okay to go seek these services. You have rights, you have, and there's access to resources for you without penalty. And also the idea of getting tested. A lot of people are worried about being tested. So they wait until they get really, really sick because of they lack health insurance, and also being able to make sure that we have enough testing for everyone so that they are not worried about paying out of pocket, or whether they need to, if they have to go into the hospital, who's going to pay for those costs? Even though there are grants, there's still that out of pocket you have to pay. So the needs are great in our communities, and yeah.
Yeah, somebody had asked that ahead of time, ahead of the meeting, whether or not the fear of the public charge issue is keeping people from seeking services. So you would say that that's true?
Yes, it is. It is still true. Again, I said that a lot of fake information goes out really fast, but the
Right.
facts has to be a lot more. There has to be a lot more effort to counter that. And sometimes, fake news travels a lot faster than the real. And we have to continue to really, in whatever way we can, sensitize these communities. And I think using the faith groups, using the smaller, non-traditional organizations that are usually, is the best way, because some of these communities are worried about going out, so the best way to reach them is through the community itself, through the faith leaders, through the small tribal groups that they have. Yeah.
Right. So that sounds like it's another role that faith communities can play then.
Definitely.
Yeah, to get the information out. Perfect. Great. We had one more question in the Q&A box. Does the center provide information regarding where to find workforce resources, education, training, things like that around workforce?
Yeah. So of course, as you know, there is the WorkSource Montgomery is offering a lot of information. And if you go on our website as well, we have a list of resources where people can look for agencies that are providing workforce training. I believe Upwardly Global is also offering now a lot of job trainings for undocumented immigrants. So they're making it open for a lot of people. So I think looking at Upwardly Global, go on our website and you see a lot of the links there of resources, and WorkSource Montgomery as well is doing great work.
Okay.
And if I could chime in really quick, Leslie. So just going back to the public charge issue, if you look in the community resources page of the county's COVID site in the immigrant and language resources section, there's a public charge section that has flyers. And if you go to the website, there's flyers in different languages, and these are community-facing materials that go over, does public charge even apply to me, because it doesn't apply to all immigrants, and what public benefits are implicated in a public charge determination. And so people should definitely go into that section and access those flyers and share them widely. And just to clarify, so we did provide the content for the immigrant and language resources section of the community resources page on the county COVID site. And the other sections were mostly developed by the county's COVID response team. In terms of just, we are trying to have everything in one place as opposed to having all these different places that people are accessing information. That said, there are certain resource lists on our website, and we, in the beginning of the crisis, were doing a lot of work to try to reach out to individual service providers to see what their current operational status was, and for the sake of our staff who were providing referrals over the phone, trying to create these lists. They were largely internal for a while so that they could provide up-to-date information to callers. We did put some of them up on the website, and they're not not necessarily, we haven't had capacity to continue to keep them updated to the extent that we would like, but they are still helpful in terms of having more community, like nonprofits, and information that is that wasn't available previously. So in that respect, the resource list, we're exploring whether to have them also on the community resources page on the county site, but I just encourage you to check our website as well as the county site. We've been needing to update our website for a while and have a more developed COVID page, but you know, that is hopefully forthcoming, but we tried to put the main stuff on our homepage for now. So just to provide that clarification on our website versus the county community resources website. But do check back both frequently, as they're both updated very, very frequently.
Great. Okay, so the question asks, how do you access the language line? Would they just call that main number for the Gilchrist Center, which we put in the chat? Josephine or
So
Yunie?
yeah, so we have a language line account, and you know, any organization that has a language line account would you know, be accessing language line on behalf of a caller or a client and be paying those charges. And so if somebody calls us that doesn't that needs an interpreter, we would access our language line account and get an interpreter on the line.
Okay, so they should call the main number, the 240-777 number?
Yeah. 4940.
Okay, great. Okay,
Yeah.
Thank you so much.
Leslie, there's another thing regarding, I got information about our Asian community from our Asian liaison. And as we talk about how communities are scared, as you know, we've had a lot of issues that are happening where communities are scared to be out, and again, having this mental health support when there are issues going on in the community. So having more mental health resources is very important for us. We also hear from our Asian liaison that there's a rise in hate crimes and violence against Asians, and the Asian community in Montgomery County is terrified and have increased gun purchases and formed online SOS groups. So Montgomery County Police Department has had several calls with the community to encourage the reporting of racism or hate crimes, which is underreported in our community. The community is also suffering from mental health issues, such as depression and anxiety caused by the anti-Asian sentiments. And we also face that in other communities as well. We're seeing that as well. So a lot of requests is made to our partners if you could ramp up your mental health support services. And whenever there is probably a 911 call, maybe have that followed by a mental health specialist or somebody who is, you know, has a mental health background. Of course, language access sometimes is an issue. People don't know, a lot of people don't know about the language access line we have in the community and how some agencies can use that to serve anybody. Another example that Yi gave us, our liaison, is that there are people who are unemployed but don't know how to complete the unemployment forms correctly. And so with one wrong mistake, they get denied. So calling into the unemployment phone line is impossible because the phone lines are overwhelmed. And so having more trainings and supporting people. So one of the things we're doing is teaching people how to fill out forms properly online and how to access that. Yeah, thank you.
Thank you so much, both of you, for being on this morning and for all the resources you're providing. And we'll put things in the chat so that people can reach out to you. Let's see, I did have one question in the question box. I don't know if Caroline is still on, about Montgomery County lawsuit and whether or not that will delay the EARP program. Caroline, is that anything you know about?
Yes, hi, I'm sorry, I missed that. The question
I'll read
is—
the question.
Okay.
The question is, could the EARP program potentially be put on hold due to the lawsuit that was filed on May 11th, where the county is being challenged in violation of federal law? That's something I know nothing about.
Sure, yes, we are aware of that. So we're having conversations internally with our Office of County Attorney. As of now, we are still moving forward with our EARP program until we receive a court order until we receive either a court order or a directive not to. So we have not been placed on hold as yet, but we are aware of the filing.
Okay, thank you so much for addressing that question. That was okay. Then moving along, I'd like to turn now to our panel to talk about what they're seeing in terms of immigrant communities. And first up, we have Diego Uriburu of Identity. Welcome, Diego. Unmute.
Thank you very much, Leslie. So, quick question, how much time do I have?
We got about 15, 20 minutes for the whole panel, and there's 3 of you. So
Okay, 5 minutes.
About 5, 6 minutes.
Okay, perfect. Well, first, I want to start by thanking all of my colleagues who are present on the call for everything you do, from nonprofits, from government. Our communities could not make it without all of you, so thank you. And it's just an act of randomness that I'm here talking and you are the listener, and all of you could be making these talks. So basically, COVID-19 has laid to bear and has exacerbated the inequities and the vulnerabilities that our clients have experienced throughout the years. The fact that so I'll share a small example and then I'll go into the topics, but this the example illustrates, we see around 3,500 youth plus their families every single year. One of those families happens to be a single mother of 3 children who are all in elementary school, who rents a 1-bedroom, not apartment, the bedroom inside a 3-bedroom apartment, who shares with other families. She cleaned houses for a living. Within a 2-week period, her clients dried up because no one else asked her to come. So within a week or 2, she had no money. She didn't have any savings. And suddenly, now she depends for all of her needs from everyone who's on the call today. What we see at Identity is a reflection of this family where, as you said before, issues regarding food insecurity, housing insecurity, people being a lot more vulnerable to illness, particularly COVID, but also others, access to basic supplies. And then you have the issue of mental health this has been exacerbated. The majority of the clients that we serve and in the immigrant populations have already had high ACEs scores, have undergone really traumatic experiences in the past, and those are exacerbated by the current situation. And as it relates to the children, for the children in the educational inequities that pre-existed COVID are in full display now, and despite the tremendous efforts from MCPS to really provide our families with Chromebooks, etc., it is really difficult for these 3 children to study, even though they have a Chromebook, when they live in a 3-bedroom apartment with 3 other families that include babies, etc. There's no quiet space to learn. This particular mother did not finish elementary school. So all these inequities that pre-existed are exacerbating every single aspect of our clients' lives. Specifically regarding hunger, the job that we do is to complement the wonderful work that the county is doing by driving food to our clients' homes, by providing complementary gift cards so the clients can complement what they get by going to buy some things to the supermarket, and also to provide them with food gift cards during the time that it takes for us to hook them up with long-term supports. So we do a complementary role there. In terms of housing, we're really focusing on those. Well, we try to help as many as possible, but we focus on those with informal leases, mainly undocumented or not, but also with informal leases who are not protected by the eviction freeze because they're third tier from the landlord, and they don't have a lease agreement, and the people who they sublease from either don't know about the freeze or don't care about the freeze. And since our clients live in an informal economy, they're a lot more vulnerable because they do not get the protections that many of us do get. In terms of social emotional vulnerabilities, as I said before, both youth and parents had really high ACEs levels, the adverse childhood experiences levels, and trauma, and the situation has exacerbated. So identity has shifted on a dime, and we are providing a lot of case management now. For example, in the past 3 days, we got almost 300 new referrals. We served in the past 3 weeks 1,000 clients, when usually we serve 3,500 within the year. So a few things that we did is that we pivoted very, very quickly. We have trained all of our staff on what we call community mental health, active listening, mandatory reporting. We are getting our own therapists plus volunteer therapists, train them on anxiety, depression, things and specific tips that they can share with the clients that we serve. In terms of, so that has been very, very powerful. We cannot meet the needs of everyone, but having 50 staff members who connect with clients every single day to train them to become better listeners and to provide with tips and then to refer to small group level interventions is very important. We are working with the county on, and we have been very fortunate to get donations from philanthropy to be able to help clients with food assistance and housing insecurity. And we hope to collaborate with the county on the ERP project. The other piece, the last piece I will touch upon is education. As some of you might know, Identity and the NAACP Parent Council created or jumpstart the Black and Brown Coalition. And we were really concerned about educational inequities before, and those inequities have been nothing but exacerbated during COVID. The educational slide is huge because, again, despite many people's efforts, the school system cannot change the inequities that led to the family that I mentioned living in the conditions that they are, the fact that the mother cannot help the children because she doesn't speak the language, etc. All of you who have children know that you are doing part of the education because the school system just can't. So we are working on recovery because we believe that despite all these efforts, Black and brown and poor are going to suffer tremendously from educational losses. So we're working with the system to really think about what recovery looks like. And we do not want to go back to normal because normal did not work for these families before. So we are having very constructive conversations with the superintendent and his team. We are being overwhelmed by the need, but I have to really thank and I feel extremely proud of my colleagues at Identity, because everyone is putting everything they have in supporting the families, because we know, like most of you know, that you are the last safety net. If they do not get help from you, then many of our clients will not get them from anyone else. So I will end with what I started by just saying thank you to everyone for the amazing work that you're doing. And I feel honored and proud to also be part of these efforts with you. So that's it.
Thank you. And can I just ask a quick question before we turn to Paula? How are you planning for summer? We saw that summer camps, the county will be holding summer camps, it looks like. What are you thinking about summer for your families?
Well, unfortunately, we had to make a really tough decision, and this might change, but we are keeping our programming to a minimum because we need every single staff member to really provide the response to the most basic needs. So we're focusing on housing, food, mental health, and our programming has declined because we're using the same resources. In speaking with the school system, it's very unlikely that they will open during the summer. So that will be a challenge. But right now, we don't have the capacity. We're beginning to think. We know what the barriers are, but we don't have the answers. And to be quite honest, we don't have the time to plan because we are, again, dealing with Maslow's pyramid, the basic needs. And those are the things that the family needs. Is a huge it's a lot more difficult for our families to cope with COVID because, again, they live in very, very small, overcrowded spaces, and the parents don't have the tools, not just to educate the children, but also to break the day into sections, to have a routine. All those things don't exist. So the situation is quite chaotic. That's why part of what we do in terms of what we call community mental health is help the parents create such schedules and what, if they can. But it's really complicated. It's really complicated, and we are thinking about the summer, but we don't have an answer yet.
Great. Well, I'm glad you're out there doing the work, and I do hear that from a lot of nonprofits that, pivoting to meet the immediate needs. And so do keep in touch. Thank you, Diego.
No, thank you.
Next up, Paula Fitzgerald from Ayuda. Welcome, Paula.
Hi. Thank you, Diego and Josephine and all of you. It's really great to hear more about all the work you're doing. So Ayuda generally provides legal services, social services, and language access, and we are still providing those services. But just like Identity and Diego, we've kind of pivoted into areas where we're seeing greater need at this moment. Our social services have been in high demand, specifically case management, like Diego mentioned, and just emergency assistance. We also are seeing a lot of need for food, and then other financial assistance to help pay for rent, utilities, childcare. There's a lot of need for transportation. We've had a number of clients who've been diagnosed with COVID, but even getting to the testing center, figuring all those things out, case management has been really helpful in terms of helping a client figure out how to go through that process and get there. And we have provided some food through partnerships we have, and we've referred a lot of people to food distribution sites. We launched a fundraiser early on this, and we've raised over $85,000, which we've made available in emergency financial assistance that we've been distributing over the last few months and continue to distribute to those in need. It might have been Josephine or Diego.
Seems like Paula has frozen, Leslie.
I see that. Hopefully she'll come on in 1 second.
Can you hear me?
Oh, there you are. Welcome back.
I was just mentioning the miscellaneous expenses. Like we had a client whose water heater broke at the beginning of this, and can you still hear me?
Yes.
Yeah. Okay. It says my internet is unstable, but and they were having to boil water to bathe the children, and so was in need of financial assistance to purchase a new water heater or someone to repair it. Diapers and formula are a need as well. We are continuing to provide therapy through remote means. However, it's very challenging for a lot of our clients who, especially those who are in abusive relationships, to find a space and time to do those therapy sessions because they're generally in really close quarters with their abusers. We're hearing a lot of reports from our clients who are experiencing domestic violence that they're afraid to leave because they're afraid that the dangers of leaving and the shelter would be greater than the dangers of staying. So there's a different balance in the mix of the dangers brought on by the COVID threat as opposed to the dangers that they're perceiving at the hands of their abusers. So that's a challenge, and we've been talking with a lot of our clients through that and doing emergency planning with them and safety planning around domestic violence. We do have also family law attorneys, and so if folks are in need of consultations around their rights regarding domestic violence, we are able to provide those legal services as well. We've provided some remote legal consultations for immigration and domestic violence family law. And we're going to we did a remote consult clinic a few weeks ago, and we're going to do another one this summer It's a good place to refer people. We spoke before about public charge. I know that's a concern. And so even if someone just wanted to talk to a lawyer to talk through their concerns about public charge and accessing COVID relief, we're happy to do that. And we continue to have our language access program running. They can provide remote interpretation or translation for those of you who partner with our language access service. And yeah, I think, the other thing is a lot of you have mentioned is this, a lot of our clients are reporting that they're having to make the really difficult decision of whether to keep themselves safe or from the COVID or to work and be able to earn a living to support their family. And it's a real challenging choice for the clients we serve. And a lot of times, because of the needs, people are having to go to employers where they don't feel safe and protected. And so that's very unfortunate, but I'm encouraged by a lot of the financial relief and food assistance that has become available. That's all I have. Leslie, unmute.
Leslie, you're muted.
Yeah, I got it. Thank you, Paula. Thanks for being here. I don't know, Meredith, were there any questions for Paula before we move on?
No, there were no specific questions, but really thank you.
Yeah, thank you for all that you're doing. And if you could put in the chat box, Paula, how people can access some of the things that you talked about in terms of, discussion with an attorney and things like that, that would be great.
Sure, I'll do that.
Thanks so much. Next up is Cecilia Rojas, Director of the Language Outreach Program for Community Reach in Montgomery County. And Cecilia, I guess we're wondering if you're seeing the same as what Diego and Paula have reported. Welcome.
Yes, first, thank you very much. Good afternoon, everybody. Thank you for having me here. Yeah, I was hearing everything, and yeah, it's basically the same issues that everybody has. So, okay, let me talk a little bit about what we are and what we do. We offer English as a second language to immigrants. Also, we have citizenship classes. So before COVID-19, we had classes in different locations, and we offer child care and child tutoring, so we were fine. So after COVID-19, okay, what happened? So we needed to decide how we are going to proceed, So we start, first of all, what we did is we got together with my staff, and after that we decided that, what different ways we can provide these English classes. So we call each student. So we had more than 100 students, like 170 to 200 students. So we call them and say, okay, are you interested to have these classes online? Because people were afraid to, were afraid to come to classes because of the virus. So yeah, a lot of them were interested and they really wanted to have these classes, but also they had challenge. Like everybody say, wasn't mentioned, but internet, Wi-Fi, computer, laptop, way to do it. So most of our students use their cell phones. That's the way they do it now, And thanks God, thank you to Michael. Michael is a really good resource that let us purchases Zoom, platform. So that's the way we start our classes. And also they use WhatsApp. Teachers use WhatsApp. We have a wonderful teachers in our staff that they sometimes, even though classes are Tuesdays and Thursdays, they sometimes, if they have a student, they cannot connect, they connect in a different day and different hours. So that's it. The other part of our program is child tutoring. So what our students are facing, okay, yeah, we talk about food, we talk about rent, we talk about diapers, because that's something that they told us. And the good thing with us is that we have a really good relationship. They trust us. So they tell us what they really need and what is the situation. So we can, provide the help they need. And we are in language outreach program is part of community reach in Montgomery County. And we have a clinic and we have emergency assistance. So that's easy way to help them if that is the need. So also in our classes, what we do is like we provide them with information. Teachers provide information where they can pick it up the food, or they can, where close by where they live, you know, it's like, so they can get all this help. And so now we talk about the children's program. It's like, it was very interesting because I always was worried our children are behind, you know, usually, and sometimes they come to this country and, you know, they don't speak the language, so they need a lot of help. So even though Montgomery County Public School doing a great job with the children, but they don't have the help they need in a way that, you know, is one-to-one, is help them with the language and everything. So that's what we're doing right now. We're doing through Zoom, through the phone, we're helping the children with homework, and you're trying to, you know, getting ahead. And even, you know, the little ones, we have preschool children in there, and we put in some books, we read books, we do all this stuff that we know they need it. So that's what we do. That's what we do. We try to help our communities hurting really bad. You know, they're losing, they don't have jobs. They are hard workers, and as you know, this community work like 2 or 3 jobs to provide their families, but now they don't have work. You know, they don't work, they can no work. So I'm very, very proud of this group of students, people, because even though they're facing all these issues, they come to classes, they you know, take advantage that now we provide classes in the morning because they are not working, so now they can take conversation classes and evening classes. So they are really, you know, in there. And also, I always say, you know, the bad things, you always need to get the good things. Now they're getting a good on technology, because they didn't have that before. Technology is a big part, it's a huge part now on our lives. So now, yeah, now they can download application, they can do that. Even if we say, okay, you can apply for this, for that, you can do it through the computer, you can do it through yourself. We're coaching them, but we're helping them. So that's basically what we do, and we're really proud of in our staff and everybody.
Thank you so much for all that you're doing, and JoAnn at Community Reach. I think you said something really important in that your clients, the people you work with, they trust you, and you have those trusted relationships. And so, like Identity and like Ayuda, and during this time, your job becomes the person who connects people with services and other help. So it's great for everyone to know that you're there, and for you also to be able to connect your clients with the rest of the sector, the food organizations and Gilchrist and everyone. So
yeah, and to get partnership with another organizations, that's the other thing. You know, we are partnership with different organizations helping us, and we have JC Jewish Community Center, and we have that. We have also another, let me get my notes, another foundation, UP to Us Foundation, Up to Us Foundation, sorry, Up to Us Foundation, that they provide food and for our clients.
Food, right. Perfect. Thank you so much.
For the agency, with the name.
Okay, take care. All right.
Thank you.
So just moving along in our agenda, I think that was really important to hear how immigrant communities are being served, and you know, again, fostering the connections between what they're doing and what the Food Council is doing, and you know, trying to meet everybody's needs. So next up, we're going to have a couple of updates on funding. But before that, I wanted to invite Ann May, who's the President and CEO of Every Mind, to come on. And Ann, you were probably listening a lot as mental health came up numerous times during this call. So feel free to chime in on that. But the reason I actually asked Ann to come and speak is she's a board member of Nonprofit Montgomery, and just to give a little bit of an update on Nonprofit Montgomery. Welcome, Ann. Thank you for being here.
Yes, thank you, Leslie. And again, Ann Mazer, I'm CEO at Every Mind, which is mental health. We obviously heard a lot across that panel and of mental health support, and I think it's really important. And I've come on to talk about Nonprofit Montgomery Partnership, but I think one of the key things, as we all are sitting here on this call today, is the importance of the collaboration of the nonprofits across the community, and that community collaboration, forming relationships and partners with all of our other fellow nonprofits. And right now, for all the nonprofits that are pivoting and adjusting and seeing that food and basic needs and mental health, right, those are the three things that are coming up across the board. And it's so important to have collaboration and coalition that helps us to meet each other and to be able to work together. So I would say, first and foremost, with these calls that Nonprofit Montgomery has been doing, for those of you that are not already members, I think you can absolutely see the value in the advocacy, the voice to the nonprofit community that Nonprofit Montgomery brings, and the coalition and partnership among leaders and colleagues across the nonprofit sector, and the value that Nonprofit Montgomery brings with partnerships with elected officials, county, state, federal, et cetera. And wanted to speak just a little bit about the value that I see in membership with Nonprofit Montgomery. For those of you that don't know, EveryMind is one of the larger nonprofits in the community. And so we have about 100 employees, but I would say that 35–40% of those employees have directly participated in Nonprofit Montgomery programs, everything from financial leadership programs, evaluation and measurements, opportunities to meet with colleagues that have similar roles and positions at other organizations through Table for 10. And so the programming pre-COVID is so important, and so important for us to continue that work. And I would say that, and when I say 35–40% have directly participated, and I would say that that participation obviously has impacted, you know, every colleague across our organization and our work, and then ultimately our clients. So I would encourage those of you that are not members, I believe right now you can talk with Meredith. She has all the details about membership, but I believe right now if you join, May and June are free, and then you have a full 12 months. And for those of us, and I think we already heard everyone today on the panel are members and colleagues of ours. For those looking to renew, I think that through July there's discount on membership if you join between now and the end of July. But just want to reiterate that, as you know, in my role as CEO, my colleagues across the organization, whether they're frontline supervisors, et cetera, the depth and breadth of the programming, and then also for nonprofit organizations in that coalition, how important it is to be a part of a coalition such as Nonprofit Montgomery. And thank you for everything that you all are doing during this pandemic, and I know that everyone appreciates that. And I would encourage everyone to renew your membership or become a member. If you have any questions, please reach out. Please feel free to reach out to me, other board members, or Meredith, I know oversees membership and programming. So thank you, Leslie.
Great. Thank you so much, Ann, for taking the time to do that. That was our PBS Pledge Drive moment. We'll keep it short, but Ann is also serving as the treasurer of our board, so she's doing work on behalf of Nonprofit Montgomery. Ann. Okay, so next up, Franca Brilliant is coming on to give us an update on some of the new funding opportunities. It seems like things are coming up all the time, either through philanthropy or through state and federal sources or county sources. And I just want to say, Franca is able to do one-on-one conversations with nonprofits through some special thing that we got from Montgomery County. So we have an intake form on our COVID resource page on our website. If you're interested in speaking directly with Franca and having a few think about applications, we also have an accountant that can help people, and some HR advice that's available. So if you have a need, please sign up for an appointment and we'll get you paired up with someone who can meet with you one-on-one. Welcome, Franca. Please take it away.
Hi, everyone. Leslie, how much time do I have? I know we're running a little, so.
You've got about 10 minutes.
Okay, okay, great. Well, first of all, I just thank you, everybody, and wow, just hearing what people are talking about with the immigrant community is incredibly moving, and just kudos to all of you for the work that you're doing. It's pretty tough out there, and it's good to know that there are people working on this stuff. So I wanted to give you, as Leslie said, a couple of updates. Quickly, some of the government programs that are open, some things that are closed, and then turn to the private sector and let you know about a couple of opportunities that I've seen recently. So first of all, let's start with the biggest one, which is the Paycheck Protection Program. It is still accepting applications. They've spent about $540 billion out of the total $670 billion that's been allocated. And these numbers are astonishing. But as you know, there have been a lot of problems with the process. If you are lucky enough to have gotten one, congratulations. Do talk to an accountant. As you know, Nonprofit Montgomery can provide you with access to an accountant so you can figure out how to get your loan forgiven. Those conditions are changing, so it's important to kind of keep up with that information. And just as a PS, apparently the Washington Post and other papers are suing the administration because they have done such a poor job of tracking where those loans went. So stay tuned. Last word on that is that there may be some more money coming into that with the House's proposal for a new stimulus bill. So again, stay tuned. Oh, I'm sorry, I forgot to share my screen. Hold on a second, I hope it's coming up. Can you all see that?
Yep, we can see it.
Okay. So, so this is what I'm talking about. The second one is the Montgomery County Telework Assistance Fund. Again, I hope a lot of you have taken advantage of that. That's $2,500 reimbursement for costs associated with your employees doing telework. The most important thing I want you to know is that the first round is closing today. So if you haven't gotten your application in, do. This is going to be done basically on a lottery, first come, first serve. So take advantage of that opportunity. The next one is the Maryland Community Health Resources Commission.
Franca, yeah. You might want to just adjust which screen's up. We're looking at bank foundations right now, and you're talking about something different. But just change in your slides so that you're on the right slide.
I'm going to stop sharing because I'm actually looking at the government update, so something is not working right here. Hold on a second.
Franca,
Maybe try again.
If you'd like to email it to us later, we can make sure to get it out.
Are you seeing it now?
Yes.
Now it says government updates. Yeah, great. Thank you.
Okay. Thanks. Sorry about that. Okay, so Montgomery County Telework, we just talked about that. Maryland Community Health Resources Commission. So this is funding to community health, clinics and the like. It's up to $50,000. That is due tomorrow at noon. So that's the deadline for that. One thing to be aware of is that doesn't cover salaries or lost revenue. So when you go to make that application, if you haven't done it already, do read the conditions. Okay. Next one, this is a little bit of an in-betweener. Those of you who are involved at any sites in Montgomery County that might be considered tourism sites having to do with the history and heritage of the county, they are not taking applications for FY20 money, but they did say that they would take applications for FY21 money, and they hope to be funded for that. So, take that as you will. Two that have closed, you heard, the Maryland State Arts Council Emergency Grant, they awarded $1 million to 125 applications, 125 organizations. I hope that some of you were among that. And as you heard, the Montgomery County Emergency Food Assistance Program, which closed last Friday, did a jaw-dropping job, honestly, of processing those applications and turning them around really quickly. And hopefully, there'll be more funding coming along the road for that. So watch that as well. One thing I wanted to point your attention to is that the banks, and I've mentioned this in a lot of the consultations, banks have a lot of pockets of money that you can access in different ways. And so I'm going to talk for a minute about some of the pathways, and then I want to highlight some specific foundations, bank foundations. So just quickly, multiple ways to access funding from banks. Some of them have official foundations, most of the big ones do. Some of them have small pockets of money that are controlled at the regional or local level, so that will be grants mostly up to about $5,000, maybe $2,500 to $5,000. They offer corporate contributions and sponsorships, and I know a lot of you are probably tapping that already. The other thing is that there's a lot that comes through employees. So if you have bank employees in your circuit, they can get matching gifts often for whatever donations they give you. There may be donations that are tied to volunteer hours, and often they can make recommendations about larger gifts. So something to keep in mind. All of these banks have foundations. This is just a sampling. I know there are more out there. I know, for example, Santander has a foundation as well. So just to give you an idea that really most of the big ones have a separate foundation, and many of them you can approach as a foundation. So to look at two of those that have open opportunities right now, Bank of America has been a big supporter of nonprofits for many years. They have come out with $100 million globally to respond to the COVID emergency, and they're putting a lot of that out through their local markets, a combination of responding to immediate needs, but also they have ongoing priorities. And so right now they have an RFP that is open till the 26th of June. The grants can go up to $50,000, not $500,000. And they have two kind of disparate goals. One of them is access to affordable housing. So that's pretty, self-evident. They want to expand and maintain affordable housing. And many of you spoke of the real crunch that exists on housing. So this is maybe a little bit longer view, but really essential for the county. And then in addition, they have what they call building vibrant communities. So this is a broader brush. This is really building communities that create economic opportunity and supportive environments for people. And so it really runs the range of community development, economic development. It might be, kind of a community support group of a certain kind. So there's some flexibility in there. And just to make it really flexible, they say, well, we'll also consider arts and cultural institutions and a few other things. So that's Bank of America. If you think, you're at all within that bailiwick, do check it out. Wells Fargo also has been putting a lot of money out into the community during this time. They've made a commitment of $175 million. Many of you may know that Wells Fargo really was engaged in some questionable behavior, not even just questionable, illegal behavior around providing people with accounts that they weren't qualified for, misleading them. And so they are really, I think, making up for that now. So $175 million out into the world. About $1 million of that went to Feeding America for food banks. And then they are also trying to do some emergency work. So support to community organizations doing that kind of work while continuing to focus on their priority areas, which are financial health, affordable housing, and small business growth. Again, they say, well, these are our priorities, but we may also do, arts and education and environment. So there may be a broader area for application here than it seems. In all of these cases, if you can talk with someone at a bank, if you have a connection to a bank, even if you don't, trying to reach out to them and talk to them, that is a good way to go because you can get feedback on whether they're likely to be interested in what you have to offer. And this is a rolling application. Oh my goodness, sorry. It's good through September 30th, 2020, not through the 90th month of the year. Sorry about that typo there. Okay. There are some new and renewed, let's say, private sector funds that I wanted to highlight for you. As Leslie said, there's a lot of stuff going on, but just trying to pull out some things that I thought might be of particular interest or you might not have seen otherwise. So the Greater Washington Community Foundation, they had a first round of funding. They put out $4 million worth of funding to 95 organizations. They're doing a second round. One thing to really note is that even if you put in an application for the first round, you should reapply. They explicitly say that. They have two categories they'll be addressing. One is direct service organizations, and both of these categories will be retroactive. So you can apply for expenses going back to May 1st. In the direct service category, you have to spend your money by July 31st, 2020. So this is really immediate turnaround, like food or, other kinds of supplies that we heard about, diapers and detergent and so on, or immediate housing assistance. They have a second category, which is organizing and advocacy. That one, you can go back to May 1st. You have 12 months to spend it, but you have to begin spending it by July 31st of 2020. In general, they're looking at populations that are particularly vulnerable, the kinds of populations that are often impacted, in fact, start, being impacted and then just see more. The kinds of things you heard about today: immigrants, people of color, low-income people, LGBTQ community, and so on. So do check out their priority communities. Likewise, they have a pretty broad range of issues they're looking at: food security, domestic violence, legal services, medical care and access, housing and homelessness, education and youth, workforce and small business. So you can see it's pretty broad. One other thing to mention is that they are really serious about racial equity, and so they have a commitment that 50% of this funding will go to organizations that have leadership of color, and that includes both board and staff. So please keep that in mind. The next one is the Chesapeake Bay Trust. So this is really for those of you who are involved in environmental education, focused in this case on, the Chesapeake Bay. It closes August 4th, up to $75,000. And just quickly, they have 3 tracks. The first track is just outreach and education. That's up to $30,000. The second track is restoration. So that's for actual projects. And the third track is for both of them, and that's for up to $75,000. So if you are doing any kind of environmental education or kids being engaged in, restoration activities, that's something to take a look at. Particularly since we've been talking about the challenges that immigrants are facing right now and just how difficult it is for people in that community, I wanted to highlight this. This is something new to me. I have to say I was really pleased to discover it. So it's closing on the 26th. I believe it's $1 million. It must be a little bit more than $1 million because it's 7 organizations. But in any case, they are looking to fund 7 organizations that will receive up to $200,000 for a 2-year period. So that's $200,000 over 2 years. And really what they want is organizations that are supporting immigrants and refugees in stabilizing their lives. They actually have a pretty broad approach to that. What it says is we want impactful community-led solutions to the obstacles that make it difficult for immigrants and refugees to achieve their goals. There are a couple of things that are really worth noting about this, one of which is that they are offering office hours every Friday, which is almost unheard of. So if you go to that link, you will be able to actually talk to somebody, and Friday's coming up, and you could ask questions if you think you have something that might be of interest. The last one that I want to mention is, this is called Love is Healing. It's by a new affinity group called Grant Makers for Girls of Color. I think they've just been around for a few years. And they are really trying to raise and distribute funding that supports girls of color. And this is a range of, I think they are very clear about LGBTQ and people who identify, with different gender identities. So that is part of what they're trying to do here. And they have a fund. They are taking applications up to November 30th. It's for up to $25,000. I do want to point out that it is by invitation only, but there is a survey, a little survey that you can take on their website to see if you qualify. And if you do, then they will reach out to you. And the reason I wanted to highlight this is that this is kind of a unique funding source and something to watch, because there aren't a lot of organizations, funders who are really putting money into organizations headed by women of color that are supporting women of color. So those are some of the new things, and I'm happy to take any questions. And thank you again for all the work you're doing. And, you know, I'm available for independent consultations, as Leslie mentioned, if you have other questions.
Great, thank you so much for that helpful update. There was one question in the Q&A box about, let me just open it, hold on a second. Can faith communities qualify for private banking funding programs?
I think you'd have to check by the program. I think that you probably would be for some of them, but I can't answer that in a blanket way. Okay.
And that was the only Q&A, unless somebody wants to chime in with another question. We are at 12:31. Maybe we'll just end there. Again, we'll make sure that we do continued webinars and whatnot with Franca to keep you posted on resources that are available. Thank you so much, Franca, and thank you for everybody for joining in today. Next week, we hope to bring you more information about what's going on with the county budget. Many of you may know that the community grants discussion has actually been postponed till this afternoon. So you might want to watch the council session and see what's going on with community grants. We're following closely the budget and hope to bring you some more updates on that next week. And also we're starting to see information coming out about recovery and what that means for nonprofits. And so we're going to bring some speakers to talk about those first stages of recovery and where we may be going from here. So thank you again for joining Nonprofit Montgomery's call. This was week 9, I believe, and we will be back next Wednesday at 11 a.m. and hope you can join us then. Thank you.